Imperial Healthcare is a group of 5 hospitals providing care to over 1 million patients a year. But what really defines us is how we combine great clinical services with groundbreaking research and excellence in education, which really helps us to drive innovations in diagnostics, management of patients, and also exciting new models of care.
So much of it is about a mindset, about how we approach things. I think so much has been traditionally built around the professional and around the health system. And actually we're here for really one thing only, and that's to look after patients brilliantly well.
It is a place of great change and great opportunity. What's great here, and it's probably because of our research background, is that this idea of innovation, of change, of pushing the boundary is there. It is what Imperial College Healthcare Trust is. The big difference is we're now to apply that same sentiment and that same drive to our clinical work, and the two are unbeatable. We are learning where tomorrow is and moving towards it.
It's really important to patients and their families that they can have trust and confidence in the services they receive, that the staff they meet are kind and considerate and thoughtful. So they're really clear about what's happening with their care and treatment.
There's an awful lot of potential here, and there's a real openness to make things happen. And I think it's really nice to work somewhere where you feel that you can try new things and you can make improvements happen.
We don't see ourselves as an independent, department just providing technology. We're in partnership with the trust, with clinicians and especially the patients. One clinician once said to me, he saw us as part of the clinical team, and that's how we see ourselves.
Care has traditionally taken place within a hospital setting, but what we're really looking to do is to break down those walls and to work more closely with our colleagues in primary and community care so that together we can provide care which is tailored to the patient where they need it and when they need it.
People's health, well-being, illness don't happen in hospitals, and that is one small part of it. We've got to get much more proactive about how we support and enable people to look after their own health better. Getting out and about on a bicycle and going and sitting with groups of health professionals and indeed patients out in the community and working with them to try and deliver care in a different way.
It's a great place to come and train. People want to come and train because they know they'll get the right kind of experience and the right quality of experience.
People come in and work incredibly hard. Why? Because there's a real sense of buzz, a sense of team, a sense of really wanting to serve the families who we look after. And the other side of the deal on that is people get a great satisfaction in what they're doing.
We do have a lot of fun, and I think our patients notice that because of the atmosphere on the ward.
I think I love everything, to be honest. I mean, looking after babies, when they come, they're so tiny, they're so sick. And then getting them better. And the appreciation you get from the parents lasts forever. I mean, that little smile on the parents' face is all that makes your day, to be honest.
There was an anaesthetist, there were radiologists, the consultant, everyone was standing around talking about my dad's care. This is 2 o'clock in the morning, and you just think everyone is here wanting to do the best for the patient. They saved his life. I can never thank or put into words the team that worked with my dad.
What I'm most proud of is the way we put the patients at the front and centre of everything we do. That, to my mind, shows that right at the heart of the organisation, it's got its values right.